Hi there, I'm Sarah Corky, the Director of Quality and Interprofessional Practice at Quinte Healthcare. I'm going to talk to you about interprofessional practice and what it means at Quinte Healthcare. As we work through the presentation, I'd like you to reflect on past experiences that you've had working within an interprofessional team. I'd like you to ask yourself whether or not it was a good or bad experience, and I would encourage you to think of an example of both. And then also try to identify what exactly was it that made it really good or really bad. In past discussions, when we've had orientation and asked this question, often some of the themes that come up are a lack of clarity around the roles of the different team members in the situation or the scenario, poor communication amongst the team members or a communication breakdown, as well as issues with respect within the team or between the team. I'd like you just to think about those and keep those with you as we work through the presentation.
The learning objectives for the interprofessional practice education includes an understanding of Quinte Health's interprofessional practice framework, an opportunity to gain awareness of Quinte Health's interprofessional practice advisory committee, to learn about elements of effective teams that assist in interprofessional collaboration, understand key professional accountabilities for all healthcare providers at Quinte Health, and an opportunity to be introduced to other interprofessional team members' roles and responsibilities.
What you see here is a visual representation of Quinte Healthcare's interprofessional practice framework. At the center is our teamwork value, we all help provide care. In order to have an effective team, you need to have good communication, role clarity, a focus on holistic and comprehensive care, as well as collaboration. Communication, the one at the top, is around having a voice and being able to contribute in a meaningful way. It's central to safety for both patients and staff and respects the thoughts and ideas of everyone involved. Role clarity on the right is about the importance of clearly understanding your role in relation to others. To do this, you require a clear understanding of scope of practice. This means your scope of practice, as well as the scope of practice of other regulated health professions and unregulated care providers within the team. Keep in mind that while we have provincial legislation, the Regulated Health Professions Act, and then profession-specific legislation from the Regulated Health Professions Act that dictate what our scope of practice is as a profession in the province, the institution, in this case Quinte Healthcare, that you work, and their policies and procedures, as well as your individual experience and knowledge, will further define your individual scope of practice. Holistic and comprehensive care at the bottom acknowledges that one profession cannot meet all of the needs of one patient. Much like it takes a village to raise a child, it takes a team to care for a patient. High quality care requires the expertise of multiple professions working together. On the left is collaboration. This is a willingness and a desire to work within a team for a common goal, and this requires open, honest, and respectful dialogue. The Interprofessional Practice Advisory Committee meets monthly and is a forum for the advancement and support of evidence-based, patient-centered care that crosses services and programs. The overall goal of the committee is to support an exceptional patient and family experience through the provision of high-quality care that's in alignment with our interprofessional practice framework. The committee provides leadership and, where appropriate, makes decisions on professional practice issues within the organization that are relevant to healthcare professions, both regulated and non-regulated, thereby supporting engagement, promoting accountability, facilitating professional excellence through adoption of evidence-based care, and ensuring high-quality patient and family-centered care in accordance with the values and strategic directions at Quinte Healthcare. The committee supports professional practice advancement and align with the Health Regulatory Colleges of Ontario with respect to scope of practice, standards and guidelines, quality assurance, and research.
Quinte Health's vision is to foster healthier, more connected people and communities with a focus on 4 aspirations: care, compassion, connection, and our people. Each of these aspirations relates to collaboration and teamwork. Our vision of fostering healthier, more connected people and communities and aspirations of care, compassion, connection, and supporting our people describes how we work and will guide us in achieving our vision. Our 4 reimagined values help to guide us in our interactions within our teams, departments, and with each other, coworkers, patients, and care partners. These values were reimagined by our teams and community, your coworkers, and our patients. How can you demonstrate these values at work? Do any of these relate to you? Teams or groups? What's the difference? Well, in a group, we have coordinated efforts, but individual goals. We have individual accountability, individual success or failure, and random skills. Whereas with teamwork, we have collaboration. We share common goals and purpose. We have individual, but also mutual accountability. We have collective success or failure, and complementary skills. As you can see in the image below the table, with teamwork, each member of the team has the opportunity to communicate with one another, which is different from group work. What would you prefer to work in a healthcare setting, a group or a team? Well, at Quinte Health, we utilize an interprofessional and collaborative approach to healthcare delivery, recognizing care elements will be shared between members of the interprofessional team. Team member characteristics. What does it take to be a good team member? Well, you can see some of them here. Empathy, flexibility, understanding, engagement, compassion, kindness, showing positivity, leadership, enthusiasm, communicating well, knowing your role, caring, trusting in the team, being respectful. We all have the ability to demonstrate these characteristics. In fact, many of them are part of being a healthcare provider. Accountability, flexibility, respectfulness, willing to learn, to name a few. We should attempt to show these characteristics within our teams. In addition to positive team member characteristics, there are some effective elements of high-functioning teams that have been discussed in literature. One of them being mutual trust and support. Mutual trust and support is the ability to anticipate and support team members' needs through accurate knowledge about their roles, responsibilities, and workload. It's also the confidence that each team member will fulfill its obligations and behave as expected. It could also include elements of psychological safety. Conflict resolution and management is the informal or formal process that 2 or more parties use to find a peaceful solution to a dispute. It also recognizes conflict. It's something that's going to happen, and it's embracing it productively and trying to resolve it professionally. Communication is a structured process by which information is clearly and accurately exchanged among team members. It's purposeful, open, effective communication and listening. Leadership is the ability to maximize the activities of team members by ensuring that team actions are understood, changes in information are shared, and team members have the necessary resources. It's the act of leading, influencing, or empowering others to maximize the efforts of the team. It could include being supportive, encouraging, leading by example, giving and receiving feedback. Situational awareness is the process of actively scanning and assessing the situational elements to gain information or understanding, or to maintain awareness to support team functioning. Really, it's just being aware of what's going on around you, with the team, with your patients, within the unit, and within yourself, that element of self-awareness. And then there's the shared goal or purpose. The goal of healthcare, the goal of our unit or our team, right? Generally, it's quality patient care. It could be mobilization after a certain amount of time, or discharge within a certain time frame. There could be unit or team charters or norms that are expected. And then there's also our organization, vision, and values. We know that low-functioning teams don't have the elements of high-functioning teams. They often are disengaged, lack accountability, transparency, have poor communication, lack enthusiasm, and have no shared purpose or goal. We have to make it a priority to utilize these elements of effective teams and recognize when the elements of low functioning teams may be making appearance within our team or on our units. Less functional, low functioning teams are really just groups of people who don't collaborate, communicate, hold each other accountable, have a common goal or purpose, and can't fully utilize each other's skills and abilities. Well, why does this happen? Well, sometimes we get in our own way, right? We have behaviors or habits, maybe reactions to stress or the fear of change, a lack of role clarity or understanding of the role or scopes of other team members. And also, it takes time. And on top of time, it takes effort. So as you can see with the graph here, we can start with a working group or a pseudo team, and we have a relatively low performance impact. We're still getting things done, but as time goes on and effort in embodying some of those positive team member characteristics and those elements of high functioning teams, we can really work towards functioning as an extraordinary team with more effort and purpose being put into our team development.
This is a list of some of the key accountabilities that you as an employee of Quinte Healthcare need to be aware of. This is by no means an exhaustive list. AIDIT is a communication structure that when used ensures that key pieces of information are included in communications with patients and families in order to avoid miscommunication and unmet needs. You are expected to use 2 unique patient identifiers when carrying out any intervention or procedure. Unique identifiers are full name, date of birth, unit number, health card number, or visit number. There are 4 moments for hand hygiene when you're caring for patients. You are expected to know and practice good hand hygiene at all 4 moments. The most often missed moment is before entry into the patient's environment. Please remember that this is your last opportunity to protect your patient from exposure to whatever may be lurking outside their room, on the keyboards, the charts, the pens, the desk. You get the idea. You are responsible for your own actions. By self-monitoring your own competencies and identifying when you have gaps in your knowledge or skill set, you are helping to provide safe and effective care. Take action to close gaps by developing and following a learning plan and seeking out additional resources. We have already talked about the importance of role clarity in an effective team. You are responsible for knowing your role as well as the roles of your team members. When you are involved in a staff or patient safety event, or when you've identified a hazard that could impact patient or staff safety, you must report this through QHC Cares so that the organization can understand any process gaps it has and take action to prevent similar events in the future. Maintaining competence means investing in yourself in order to maintain and grow your competence over the course of your career. QHC as your employer has an obligation to provide some key training, but it is a shared obligation and accountability. Knowledge of your professional standards and the policies and procedures that influence your practice in your role is essential. Working collaboratively includes being aware of incivil behaviors and how they contribute to conflict and team dysfunction. You will also have already heard about the Behavior at Work policy, which helps to articulate what behaviors align with QHC's values and beliefs and those that don't. Email is the most commonly used method of communication within Quinte Healthcare. As an employee, you are expected to review your emails regularly in order to stay up to date with current activities. This is especially true in our current environment. There are many other ways in which information is shared, like our weekly bulletin, vital signs newsletter, practice reminders, huddles, posters, and unit communication binders. But email is the universal and most reliable method. It's not enough to say nobody told me.
Your team members or members of the interprofessional team can be seen on this slide, and each member plays a very important role within the patient experience and their journey within Quinte Health. Being aware of your team members and the roles that they play within the patient journey can help you and your patients. Review the following slides to learn more about some of your team members' roles and responsibilities.